Hey guys, my name is Danielle. I'm a second semester HBU student. So the following video is going to be covering your vital sign checkoff, what you need to know, and how to perform it. Lena is going to be in the role of the nurse, Avila is going to be in the role of the patient, and Japera is going to be playing your professor, who's going to be sitting by the end of the bed and is going to be prompting you by asking questions in case you forget anything. So just sit back and enjoy the video, and if you do have any questions, we do highly encourage you to find any semester student that is roaming the campus.
Hi, my name is Lena, and I'm going to be your student nurse today, okay?
Okay.
I'm just going to pose right so we can have a little bit of privacy. So I'm just going to go ahead and wash my hands, okay?
Mm-hmm.
And then, can I get your first and last name and your date of birth?
Avila Valadez, 1/12/96.
Okay, perfect. So, are you experiencing any pain today?
No.
No? Okay, perfect. So, on a scale of 0 to 10, it's a 0?
Yes.
And do you have any allergies?
None.
So, I'm just going to go ahead and get your vital signs today.
Mm-hmm.
So, I'm going to get your temperature, I'm going to get your blood pressure. I'm also going to put a pulse ox on you, which is just a little thing that's going to go on your finger. And it'll measure your oxygen levels and also your heart rate.
Okay.
So, now we're going to take your temperature, okay?
Okay.
Go ahead, open your mouth. Awesome. And I'm put it under the sublingual, underneath the tongue. Okay, perfect. It is within normal range. It is 98.5, and the normal range is 98.6. So now, Avila, I'm just going to check your pulses. Okay, so I'm just going to check this arm. Okay. Good. Now I'm going to check your other arm and make sure that they're both bilateral. Okay, perfect. I'm just going to find your brachial pulse too. Okay, awesome. Let me find your other one. Okay, perfect. Okay, so Avila, so I'm going to go ahead and take your pulse, okay? So I'm going to hold your radial pulse right here for about a minute, okay? Okay, Avila, so your pulse was 80 and the normal ranges is between 60 and 100. And then the last 30 seconds, I was also counting your respirations, and your respirations were normal. They were 18, and the normal is between 12 to 20. Okay, Avila, so now I'm just going to put you on a pulse ox. I'm just going to go ahead and clean it first. That way it's sanitized for you. Okay, before I hook you up onto that, I'm just going to go ahead and check your capillary refill, okay?
When checking your partner's capillary refill, make sure it is less than 2 seconds for the color to return back to normal after you have released their finger.
Okay, so if you give me your index finger. Okay. Okay, Avila, so your oxygen is 97 and your pulse is 82.
Can you show me the pulse oximeter, please?
Absolutely. So here is the pulse. It says 80, so it's going between 80 and 82. And then her oxygen is 97, and the normal levels for the blood, for the pulse is between 60 to 100, and then the oxygen level is between 95 and 100. Okay, Avila, so I'm going to go ahead and take your blood pressure first, okay? Not first, but I'm just going to take your blood pressure. Okay, so I'm just going to go ahead and clean my stethoscope.
Before you take your partner's blood pressure, you need to determine how high to inflate the blood pressure cuff. In order to do so, place the blood pressure cuff on your partner's arm. Then, take your index and middle finger and place them on the radial pulse. Continue to inflate the blood pressure cuff until the radial pulse is no longer felt, then add 30 to this number. Next, completely deflate the blood pressure cuff and allow your partner's arm to rest. Then, re-inflate the cuff to the number that you previously got in order to determine their blood pressure reading.
Okay, Avila, so I'm just going to find your pulse right here. Okay, found it. So I'm just going to go ahead and put the blood pressure cuff, and where this arrow is directly right where it was, and you want to put it about like maybe 1 or 2 inches above right there. Okay, perfect. Make sure you hear it before you start. Okay. Okay, so your blood pressure is 112/75, and the ideal blood pressure is 120/80. So you are normal. Okay, Vila, thank you so much for everything. Is there anything that you need before I go?
None.
Okay, awesome. So here's your call bell, and your bed is in lowest position. Okay, Professor Japera, so I'm going to go ahead and document everything, the vital signs, and document also my assessments on the patient's chart.
Hey guys, it's me again. Just the last few minute tips before you get started. Make sure you print off your vital signs check-off paperwork. Clarify with your professor on any attire or any certain attire that they want you to have. Arrive 30 to 45 minutes prior to your sign-off time. And guys, nerves. I know it's a thing. You're going to be nervous going in there, but I believe in you, and y'all are going to do great. Good luck on your vital sign checkoffs, and I hope this video helped. Bye!